Hello, class. It is KP. I just wanted to give you a quick recording to give you some information about the upcoming simulations in the next couple of weeks. Everyone did awesome in virtual reality. I hope you had fun, and we're going to have more opportunity to do that soon. We're really excited this year to bring virtual reality as a modality to our simulation experience, in addition to the use of standardized patients. And you're going to get the opportunity to do both experiences. Just keep in mind that we know you are students and you are still learning, and this is intended to give you an experience where you can apply some of the knowledge and skills that you've learned in class, but still have it in a safe and supported environment of the simulation lab before you go out into your practicums. So this is in no way does it need to be perfect. We expect that there will be mistakes because you are still learning. We are all still learning. Here's just a reminder about simulation in general and some of the guidelines that we follow whenever we're in the sim lab. Like I just said, this is a learning opportunity. It's okay and it's expected that people will make mistakes. It feels very real. And so that's a really good way for you to learn from those mistakes because it's safe. We're not hurting anybody because it's either an avatar or an actor. We also like to assume good intentions and efforts from everyone involved. Everyone should show up trying their best, and we assume those good intentions. There's also suspension of disbelief. So sometimes we have to kind of believe that things are true, even if it's not really true, or if we seem like it's impossible. Like you're going to be interacting with the avatar or a mannequin. Um, there may be an opportunity for you to perform some tasks that you're not trained in, like if you were going to suction a patient or do oral care with a patient or do a fees study. You're okay, you're allowed to do that in this situation because it's simulation. We're also going to maintain confidentiality, right? Mistakes are going to be made, but we're not going to go and talk about them because this is a safe learning environment and what happens in simulation stays in simulation. This is the first year that we are using virtual reality, and so we're going to collect some data for research purposes regarding the effectiveness of virtual reality versus the use of standardized patients. Because of this, your groupings for scheduling, you have been divided into two different groups where half of you are doing virtual reality first, followed by healthcare theater, and the other half are doing healthcare theater first, followed by virtual reality. There will be two different experiences, a virtual reality experience and a healthcare theater experience. They will all take place on the fourth floor of the tower. Um, and at the end of your simulation, there will be an anonymous survey that you complete that just kind of asks you questions about, your experience because we want to know your feedback. It is anonymous. One of the questions is a question giving consent so that we can use your answers in our research. You will receive background information on all of the cases. They'll be posted on Canvas. There are 4 different scenarios, 1 virtual reality and 3 healthcare theater. And you'll access that information on Canvas in the module called simulation. And be sure to read that information ahead of time and come prepared to jump right in because the time that is on the schedule is the time that your simulation starts. You won't, because each person is doing this on their own. We're really like, this is your pre-brief. We're not going to be talking to you in addition to this recording. Okay, so more specifics about the virtual reality. This will be very similar, a similar environment to the sandbox version that you did this week. The patient will be in the hospital and in need of a swallow eval. The patient in our dysphagia patient will be able to answer more questions than the sandbox version, and the patient will be able to follow some simple directions that would be necessary for orientation, oral motor, a swallow eval. There will be suction toothbrush, and food will all be available in the room. And please try to engage with the avatar as if it's a real person. Like we talked about this past week, the more you speak out loud and engage with the avatar, the better we will be able to moderate your case and give you the appropriate answers to help keep you on track and have the best experience. Um, Additionally, oh, there's my dog. Hey, Cooper, we love you. He sees a bird. All right. Um, you will be able to give recommendations. So think about what diet you want to put the person on and if they need other professionals to see them, if you need to do other studies. And because this is virtual reality and we have suspension of disbelief, if you need to proceed and do an additional study, you have the ability to do that in virtual reality. So even though you're not trained or certified, go ahead and do some additional testing if needed. Um, so you will have about 15 to 25 minutes to interact during the simulation, and then we will stop you, and you'll have 15 to 30 minutes to debrief, where we'll kind of talk about what went well, what we could have done differently, and then you will take your anonymous survey before you leave. So that is virtual reality. People are scheduled in 1 hour time slots, and that's completed individually. And then the standardized patient situations or healthcare theater, there are 3 simulations that you'll be working through, and that will be interacting with a standardized patient or who is a live actor. Um, and in those 3 situations, for 2 of them, you will be the primary SLP, and for 1 of them, you will be an active observer. Again, you're going to want to interact with the patient as if it is the real world, using standard precautions, good communication skills, complete the swallow eval or treatment, whichever is appropriate for that patient. And for each of the standardized patient situations, you'll have about 15 minutes to interact in the simulation, and then we'll have about 15 minutes to debrief um, with you and the partner. If you are an observer, you will also participate in the debrief. And then at the conclusion of that day, when you've completed all 3 simulations, you will fill out your second anonymous survey. Ah, look at that and have fun. Remember, this is a learning opportunity and it really is a cool and amazing um, format that we have at University of Delaware. You're really lucky that you're able to do these things and give you a little bit of confidence before you go out to your practicums. And you're all going to be amazing. Ask me if you have any questions. Thank you.